Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about Lyme disease. In particular, I will cover what is Lyme disease, how you treat it, and how you can better live with Lyme disease. So we start with what is it? Lyme disease is an infection that is transmitted through the bite of a tick infected with a bacterium called Borrelia burgdorferi. Ticks typically get the bacterium by biting infected animals like deer and mice. Most people who get tick bites do not get Lyme disease, and not all ticks are infected, and the risk of contracting the disease increases the longer the tick is attached to the body. So Lyme disease is not a common infection. It is estimated that there are between 50 and 100 cases in Ireland every year. The ticks that cause Lyme disease are commonly found in woodland and heathland areas. This is because these types of habitats have a higher number of tick-carrying animals such as deer, mice and sheep. Due to their breeding patterns, the tick population is highest in late spring and early summer. So for early signs and symptoms of Lyme disease, a small red bump similar to the bump of a mosquito bite often appears on the site of a tick bite or tick removal and resolves over a few days. This normal occurrence doesn't indicate Lyme disease. However, these signs and symptoms can occur within a month after you've been infected. So you have a rash from 3 to 30 days after an infected tick bite. An expanding red area might appear that sometimes clears in the centre, forming a bullseye pattern. The rash, which is erythema migrans, expands slowly over days and can spread to 12 to 30 centimetres across. It's typically not itchy or painful, but might feel warm to the touch. Erythema migrans is one of the hallmarks of Lyme disease. Although not everyone with Lyme disease develops the rash, some people develop this rash at more than one place on their bodies. Other symptoms would be fever, chills, fatigue, body aches, headache, neck stiffness, and swollen lymph nodes can accompany the rash. Later signs and symptoms, if untreated, new signs and symptoms of Lyme disease might appear in the following weeks to months, and these include the erythema migrans. The rash may appear on other areas of your body. Joint pain, so bouts of severe joint pain and swelling are especially likely to affect your knees, but the pain can also shift from one joint to another. And neurological problems, so weeks, months or even years after an infection, you might develop inflammation of the membrane surrounding your brain, which is meningitis, temporary paralysis of one side of your face, which is Bell's palsy, and numbness or weakness in your limbs and impaired muscle movement. The less common signs and symptoms would be several weeks after infection. Some people develop heart problems such as an irregular heartbeat, eye inflammation, liver inflammation, and severe fatigue. So for diagnosis, Lyme disease can be a difficult condition to diagnose, particularly in its later stages, because its symptoms are also shared by other more common conditions such as infections or arthritis. While the characteristic skin rash can provide an important clue, not everyone with Lyme disease will develop the rash. If you do not develop the rash, you will need to have some tests so that your GP can confirm or rule out a diagnosis. So next is, how do you treat Lyme disease? So antibiotic tablets are recommended for the treatment of early stage Lyme disease. Most people will require a 2 to 3 week course of antibiotics. If you are prescribed antibiotics, it is important that you finish the course, even if you feel better, because this will ensure that all the bacteria are destroyed. These usually include doxycycline for adults and children older than 8, or amoxicillin or cefuroximine for adults younger and children and pregnant or breastfeeding women. So mid to late stage Lyme disease can also be treated with antibiotics. If your symptoms are particularly severe, antibiotic injections or IV antibiotics may be used. Most people with mid and late stage Lyme disease will require a prolonged course of antibiotics. The antibiotics that are used to treat Lyme disease can make your skin more sensitive to sunlight. Therefore, you should avoid prolonged exposure to the sun and avoid using tanning equipment until you have finished the course. So for pregnancy and breastfeeding, if you're pregnant and get Lyme disease, treatment with antibiotics will not pose any additional risk to your unborn baby. As the bacteria that cause Lyme disease cannot be passed on through breast milk, it is safe to continue breastfeeding if you have Lyme disease. So how to remove a tick? If you find a tick on your skin or your child's skin, you should remove it by gently gripping it as close to the skin as possible, preferably using fine-toothed tweezers, and pull steadily away from the skin. And finally, how do you live with Lyme disease? Whether you're receiving treatment for Lyme caught in the early stages or living with chronic Lyme disease, these supportive therapies will help you fight the infection and feel better. So first is get lots of rest. Avoid caffeine or other stimulants that may affect sleep. Avoid alcohol or use in moderation. And don't smoke. Exercise to your ability when possible. And modify your diet to include high quality protein and high fibre and low in fat and carbohydrates. And reduce simple carbohydrates. Use those with low glycemic index. Finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing Lyme disease more effectively on a day-to-day basis. To start with, we have numerous products to get you started and up and running on an exercise program. So we've floor mats, exercise balls, various weights and other pieces of equipment. We also have various supplements and products which you can purchase from us without a prescription, such as antihistamine tablets, steroid creams, anticin creams, Urax cream and lotion, and Baraka and ginseng for energy. Plus we also stock light boxes to promote relaxation, and blood pressure monitors, blood sugar monitors and body fat monitors. So that brings the video to an end. Customers of Lynch's Pharmacy can avail of our brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing Lyme disease with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.